Before getting a tracheostomy tube, the only two infections of the airways I ever heard of were bronchitis and pneumonia. Bronchitis is inflammation of the airways leading to your lungs, and pneumonia is an infection in your lungs. Once I got a tracheostomy tube, I suddenly started hearing doctors say the words tracheitis and tracheobronchitis. I was now introduced to a whole new world of inflammation and infection. Join me this week as I discuss the medical conditions tracheitis and tracheobronchitis. Breaking down the word into its parts, tracheitis means trachea and itis. Trachea is often referred to as the windpipe. It is through the trachea in which a hole is created to place the tracheostomy tube. Itis simply means inflammation. You are probably familiar with other conditions which cause inflammation, such as sinusitis, which is inflammation of the sinuses, tonsillitis, which is inflammation of the tonsils, appendicitis, which is inflammation of the appendix, and the list could go on and on. Normally, bacteria and viruses are stopped via your immune system in your nose, mouth, and upper airways. As the air travels through the respiratory tract, there are many defense systems in place to stop bacteria and viruses. However, as the air enters the lungs, the immune system decreases in intensity since most of the viruses and bacteria have been trapped or killed higher up in the respiratory tract. Very few bacteria and viruses make it all the way down to the lungs. In a person with an intact respiratory tract, this setup works well. However, having a tracheostomy tube means microorganisms do not have to overcome all the immune responses in the upper airways and now have direct access to your lower airways. Thus, tracheitis is more prone to happen in people who have a tracheostomy tube. The trachea is the passage into which the tracheostomy tube is placed. As you travel further into the respiratory tract, the trachea divides into smaller branches called bronchi. So tracheobronchitis is the inflammation of the trachea and bronchi. Many times, microorganisms are introduced into the trachea while doing a tracheostomy tube exchange. Although a person may use sterile technique and the utmost care while doing the tracheostomy tube exchange, bacteria on the skin is often pushed into the trachea when the new tracheostomy tube is inserted. Tracheitis can also occur when the tracheostomy site becomes infected. The skin infection can migrate into the airways from the natural movement of the tracheostomy tube in and out of the trachea. Although the tracheostomy tube holder keeps the tracheostomy tube secure, the tracheostomy tube still moves when you swallow, speak, sneeze, and cough. The movement of the tracheostomy tube can allow bacteria on the skin to enter the trachea. A third way tracheitis can occur is when a person breathes in viruses and bacteria in the air. Once inside, the microorganisms can infect the trachea. They then can move further into the airways and infect the bronchi. Infection creates an immune response which causes inflammation. When both the trachea and bronchi are inflamed, this is called tracheobronchitis. Tracheitis causes swelling in the trachea. This may cause pain. The tracheostomy site may become red, and tracheitis may also cause a sore throat, and swallowing may become painful. The infection in the trachea can also travel up the airways. The person may experience pain and pressure in the ears and a stuffy or runny nose. Tracheobronchitis may cause all of the above symptoms, but the major difference is tracheobronchitis almost always has an increase in sputum production. The sputum is often thick and may clog the tracheostomy tube. For more information about sputum, please see the video, In Sickness and in Health, Know Your Sputum. Tracheobronchitis can cause a fever, cough, and often mimics pneumonia in presentation. Tracheobronchitis and tracheitis are often diagnosed based on physical examination and symptom presentation. A chest X-ray is frequently ordered to rule out the possibility of pneumonia. Blood work may be completed to check inflammation markers and white blood cell count. Sputum should be collected from the tracheostomy tube, sent to the laboratory, and cultured to identify the presence of bacteria which may be causing the infection. Treatment for tracheobronchitis and tracheitis usually includes drinking plenty of water, getting lots of rest, and taking over-the-counter medicine for pain and fever. Using bronchodilators, such as inhalers or running medicine through a nebulizer, may be used to help open up the airways. Antibiotics may or may not be given. Since bacterial infections are common in people with tracheostomy tubes, some doctors will automatically prescribe antibiotics if a person with a tracheostomy tube has a respiratory infection. Other medical providers will only give antibiotics if the sputum culture shows bacteria is causing the infection. Some physicians do not take tracheitis and tracheobronchitis to be serious conditions. They may brush aside the symptoms. For people with tracheostomy tubes, these medical conditions can be very serious infections which can lead to complications such as pneumonia and sepsis. If a respiratory infection is suspected in someone with a tracheostomy tube, please always request a sputum culture. Once the sputum culture has been resulted, follow up with the medical provider to make sure the appropriate treatment is being administered. I cannot tell you how many times I've been given an antibiotic only to find out from the sputum culture results that the antibiotic I was given is completely ineffective against the bacteria in my airway. If I would not have contacted my physician, I would have not been given the correct antibiotic. Thank you so much for joining me. Please remember to like and subscribe down below. I hope you have a great day and a wonderful week. Bye-bye. Fun fact, I actually have tracheobronchitis and I'm trying to do this video and it's been very hard because I'm coughing a lot. So I hope you can understand everything in this video and I hope it was clear. And hopefully this tracheobronchitis is soon nothing more than a distant memory. Bye.